to get started, and we are ready to go. Hello and welcome to the PTZOptics Healthcare webinar. I am joined here with Dr. Kevin. Hi, Kevin. Thank you so much for joining us. Kevin is our new healthcare market specialist at PTZOptics, and we've put together a panel of experts to talk about how cameras and video technology are impacting healthcare and really making things more efficient, not just in telehealth, but all across different areas of healthcare. So Kevin, do you want to tell us a little bit about yourself before we jump in?
Absolutely. Thanks for the introduction, Paul. I am the new healthcare sales engineer specialist here at PTZOptics. I'll be helping to revolutionize the AV world of healthcare with PTZ cameras, improving AI workflows and systems with high-end cameras to increase efficiency and vision. So doctors and healthcare professionals can focus on care and what matters. My background is in healthcare and in software. I originally built USP compounding pharmacies on the West Coast for several clients. Then I've worked in healthcare and ended up here at PTZOptics to blend my love of AV and of the medical field. Excited to be here.
Thank you for joining us. And then also joining us is Brandon Eller, coming in all the way from Washington. How are you today, Brandon?
I am well, Paul. How are you? And how are you, Kevin?
Fantastic. Thanks for joining us, Brandon.
Yeah, thanks for being
Absolutely.
here. Brandon comes to us from StrongArm Healthcare. We have one of their healthcare carts here on display. So I don't know if we can show that really quickly, but you guys have really done an amazing job innovating in the healthcare space. Do you want to talk a little bit about this cart?
Absolutely. So once again, thank you, Paul and PTZOptics team for setting this up, and of course, Etay. To jump right into this cart specifically, and we've spoke about this before at trade shows and other webinar style platforms, that I came from the cart side of the industry, point of care overall, and the one alarming thing about carts that currently are in the market is 90+% of them tend to end up in a boneyard at the bottom of the hospital because they were a one-use cart. They didn't last long, and anything that StrongArm Healthcare builds, we build it to last. And so we had to build a cart that could maneuver from a scalability perspective, but also from a durability perspective. It was critical that this cart did not end up in a broken dead space in a hospital. And so this cart, as you see configured for the application we'll just be discussing today, is probably one of well over 100 different configurations that this cart can be changed by the end user to adapt or pivot to technology changes or program needs. So our goal ultimately is that this cart, its an original use, gets utilized for 5 different workflows over the span of its life as well as the hospital's life.
It's been so fun to see the innovation with this cart, by the way, and we'll go into a lot of the details. Featured on this cart, we have a touchscreen iPad with LayerJot installed, and joining us is the CEO of LayerJot, Etay. How are you doing today, Etay?
Yeah, doing great. Thanks, Paul. Thank you for having me.
Our pleasure. Thank you so much for joining today. We're going to jump into a live demo. Etay, why don't you just tell us a little bit about LayerJot and what you're doing in the healthcare space?
Yeah, thank you. So LayerJot is a technology company that really focusing on healthcare, and we are focusing on helping surgical logistics, especially around surgical instruments and identification, and providing information for people like sterile processing technicians and staff at the OR. And what we've been using the technology for is for tray assembly, surgical tray assembly. But specifically, the collaboration with StrongArm and PTZ is about the ability to create a data-driven approach for usage analysis of surgical instruments and supplies at the OR in real time. And the idea behind it is that it's a known secret that over 70% of the instruments that are being prepared for surgery are not actually used during surgery. And this industry is not very data-driven, it's very drama-driven, and people cannot agree on which instruments to use or not, or remove from trays. And by providing a data-driven approach and actually analyzing the usage of instruments in real time, we can change and move the needle for this industry, drive cost of surgical procedures down, and improve, the economics for hospitals and, of course, patient outcome.
It's amazing. And we've been looking at it with so many different healthcare professionals. So I'm going to do a quick deep dive with Kevin, a quick overview, I guess I should say, of the healthcare industry and what some of our partners and customers are going through. And naturally, we're going to dive into a full demo of LayerJot to see what kind of computer vision and next generation AI is doing in healthcare. And then we'll go to Brandon, who's a USA manufacturer who's building high quality products and equipment for the healthcare market. And I'll let Kevin go first and kind of explain some of the areas in which we work on. And we have some polls that we'll be doing as well to kind of get a feel for what everyone's doing in healthcare.
Excellent. Thanks for starting us off, Paul. So yes, the current landscape in healthcare, we've identified several spaces where we're already helping some of the largest hospital systems and health networks in the country. And there's other places where we see that our cameras can be highly effective. So the first, virtual nursing and remote patient monitoring. One of the great things about this cart is that you can have a camera attached to it. You can either have an iPad or a computer with a keyboard, and you can roll it in right into your patient room to help improve those nurse to patient ratios, help improve virtual rounding. So instead of a nurse having to stop by every single room to check on a patient, they have a camera with vision of the patient that also has a built-in speaker and a microphone. So the patient can communicate with them, they can communicate with the patient remotely. It's going to be an excellent way to improve your rounding processes, save some time for your nurses, and make sure that you don't have any patient rooms that are overlooked during that rounding process when you might have an abundance of rooms and a shortage of nurses. We also are looking at surgical optimization and marketing. So you can use this camera in your surgical suite to record your process and take notes. That way you can optimize your surgical process to make sure that you're not missing any steps, that you're taking all your details into account. And then you can even use that footage for marketing purposes. Show off your skills in the surgical OR. In addition, in that same vein of surgical optimization and marketing, you can also use these cameras to record your procedures for clinical education purposes. Being able to record your procedures to show it off to medical students allows you to expand your reach. Instead of having only a few that can shadow inside the OR, you can have an adjacent room where you have 20 or more students that can watch the procedure in real time or from a remote location. So improving clinical education with these cameras as well. And then coming back to remote telehealth, what we mentioned first. You can use these cameras to have specialist consults. If you have a specialist in another country, in another state where they wouldn't be able to visit this room and this patient otherwise, they have eyes, they have ears, and can consult from a great distance for specialists. And you can even use it for remote telehealth, roll it into a doctor's office so that they can reach other patients from the comfort of their space in the hospital.
Awesome. So some of the benefits here that we're seeing is improved efficiency, increased safety, and visibility during the care delivery process. It's reducing kind of some of the unnecessary tasks, some of the grunt work, if you will, of putting away instruments and categorizing things. AI and computer vision can help with that. We're expanding access to care in rural and underserved areas. And we're supporting clinical training and accredited goals. So when you look at what we're doing here, it's all the way from an educational space to really like operational, like ORs and delivery of care. So it's really wide reaching. And one of the great things about PTZ cameras specifically that we're going to show today is that you can remotely control these cameras. And today we're using Zoom, and PTZOptics actually supports far end camera control of PTZ cameras in Zoom. So that's a really great way that doctors use just for telehealth purposes. But we also offer a lot more. And for one thing that's important, and we get this question a lot, is that these products can be used in a HIPAA compliant way. That means that we do not record any patient data, any private patient data on the camera itself. We have secure, encrypted methods of transferring video. And because of that, we're very much trusted across hospitals, clinics, and educational institutions for these types of use cases. Now, as Kevin said, in patient rooms and in telehealth, privacy is super important. And that's why starting in 2025, all of our cameras come with the new privacy mode. And the privacy mode is able to have the camera literally pan so that it's facing the wall. Because it's not just privacy, like not sending any video data that's private, but also ensuring that patients feel the privacy and feel as though the cameras aren't looking at them. So static cameras that don't have the ability to turn around and look at a wall and point at a wall, they don't give the patients the feeling that they're not being watched. So from a privacy perspective, we thought that was really important. And I don't know if you want to cover this one, Kevin.
Yeah, we'll talk about some of the benefits of having a camera inside of your patient rooms. So first, it enables virtual rounding and consults via Zoom and Teams. Our cameras are compliant, are HIPAA compliant, and work with Zoom and Teams seamlessly, along with other popular broadcasting like VC. Other benefits, the controlled camera movement you can control those camera movements from a nurse's station or remotely. So from the nurse's station, you could have one nurse viewing 8 or 9 rooms at a time, and they can even control those cameras from that spot. These cameras will reduce staff exposure, especially in quarantined areas where nurses are going to have to scrub up and take some time to put on all of their protective, their PEI. So reduce staff exposure and improve patient safety with these cameras. And family members can join virtually for updates or visits. Actually have your family check out, patch into the camera. They can check out a feed and check in on their family members without actually going to the hospital.
Now, we recently went into an operating room and got a chance to test out LayerJot. And we got to see for the first time in my career, I got to see OR stats, and it's computer vision designed for operating rooms. And I wanted to hand this over to Etay. And Etay, maybe you could tell us a little bit about what OR stats is and how you're using computer vision in ORs. Just go ahead and unmute yourself, Etay.
Oh, thank you. I would like to share my screen. So I'm going to share a portion of the screen. Let's see if that works. And see if I can do that. If not, I'll just, okay, sorry, I won't get too fancy with it. So I'm going to share my screen. I guess this one has different settings. So do you see my screen?
Yes. And while we're waiting, we're just going to deploy the first poll and just ask a question here. What matters most when selecting a mobile telehealth cart? A high quality integrated PTZ camera, strong cleanable cart design, or a competitive price? All right, go ahead, Etay, and I'll share the results of that as we move forward.
Okay, thank you. So on the right screen, you can see my iPad, which is next to me, and it's showing a generic computer vision capability by LayerJot. On the left screen, you see the actual view from this OR stats card. And I want to talk about a few things before I dive into the demo. The first is that we're using the StrongArm card and the PTZ camera and our iPad with the technology to create a complete solution for the use case of tracking surgical instruments. Another thing to talk to Paul's point, the camera is being fully activated by the iPad app through the API using PTZ, which means we have full control over the camera remotely or otherwise from the iPad, which allow us to switch into privacy mode when we need to, and then reactivate it in order to be able to recognize surgical instruments. And then this is voice activated, but also this is what we use with buttons. And then as surgical instruments are being displayed or played in the area of the camera, zooming at specific areas that the patient is not at, known as the back table, when instruments get organized, or the Mayo stand next to the surgeon. And what you can see here in parallel is that on the right side, this is our computer vision technology recognizing the instruments and providing you additional information. And on the left side, you can see the identification of the instruments as part of the OR stats. So this identification is used in order to analyze usage of the surgical instruments in real time. So at the end of the procedure, the recording is ending, and you have access to all the information that was gathered. You can even control and decide that you would like to delete a specific picture, and you send it for analysis. And that gets you to the point where information of surgical instruments and supply that were actually used during the surgery are compared to the one that were prepared for the surgery, allowing you to optimize the surgical trays and case cards based on data. And all of that is doable from a distance. So the PTZ camera has an amazing zoom, and we can recognize these instruments from a distance of over a meter, which is very suitable for the use case of having this card away from the surgical field. So we are very happy with the full control over the camera, the quality of the image, and the streaming of video over network. So this is how we use our PTZ camera for the OR stats and utilization analysis.
Awesome. In fact, I'd like to go to the cart we have here. We've got this actually set up, and I just want to show it with kind of a full standing setup here. We have the iPad set up right here, the PTZ camera here. And then right here we have the trays. And then this is a fully mobile cart, right? So it can roll around from where it needs to go. It's got a battery pack in here. Brandon, I don't know if you want to say a few words about the cart while I have it here, but it's fully ready to go. It's got this really nice handle. I understand it has like a lifetime warranty, and I'm happy to show this in a little bit more detail as we get questions. But this is just a really well-built cart, Brandon.
Yeah, so in this configuration that you're handling right now, which was actually one of the initial demos that we had built for LayerJot because we were still in the collaboration phase. So technically speaking, underneath that Mayo stand towel that has surgical instruments on it currently is a work surface with a keyboard that actually is able to be pulled out. But for the purposes of viewers and educating from this configuration perspective, we've already done probably north of 50 different configurations that have up to 5 different workflows associated with them. In the particular LayerJot project, the newest variation or configuration, which is going to be landing on site in the next few weeks, is a lot more lean overall from a form factor and accessories perspective. So that once again is the beauty of this, not only the project with LayerJot, but it really highlights the capability of this cart because in the span of about 3 months, maybe 4 months when we started with LayerJot, since the inception to go live status, we've made considerable tweaks and changes, but they haven't been difficult ones because this cart is fully scalable and we can pivot around LayerJot's end user needs. And overall, that's why this partnership is moving fast and going incredibly well.
So I want to make a thank you, Brandon. And we're doing a nice little tour here of the cart by our producer here. Wonderful job. I want to show the interface that we provide for camera control, so we can get an idea of the view from the camera. And you can see here that this is a software called PTZOptics Hive. And basically you can just kind of tell the camera where you want it to go. You can choose a specific spot, and zoom into that spot very easily. And this is just showing how easy it is. Now, you can imagine if you were a physician or a doctor who wanted to be able to record a video to show your processes and your surgeries, you can do this just by hitting the record button, right? Now you need to record that obviously on a private shared area, but just showing you kind of some of the intuitive tools that we have for controlling the camera, zooming in and out. And then I wanted to mention that this is connected via USB to an iPad. And so you can connect these new iPad Pros directly via USB to the PTZOptics cameras, and they are able to bring in the video. Now we're getting a question here. How do you know which instruments are being used by looking at the back table? Can it recognize instruments when they are in a surgeon's hand?
Yeah, so we are recognizing, this is a workflow question, so we can recognize instruments in different settings, either on a towel or in a hand. For OR stats from an operation perspective, in order to reduce friction in the OR, we currently analyzing activities in the Mayo stand, which is a little stand that is between the back table where all the trays are kind of spread out. And these are the instruments that actually been handed over to the surgeon. It's kind of a staging area. So analyzing instrument there is one way. Another thing is we can identify modification on the instruments like blood and other things that were added to the instrument, so to speak, and therefore kind of count it. And this is the different ways that we can do that. So our ability to analyze and recognize instruments without the need to read a barcode or a SKU of the instruments, although we do that, we do it by shape and other things, allowing us to work in an unstructured environment like the operating room and help sterilization department build the trays correctly.
Great. And so LayerJot basically integrates with OR Stats so that you can streamline all the surgical counts.
Yeah, we have several tools like CountSheet AI that can manage the count sheet, which is the BOM of instruments that are used in surgery. And then we can analyze against that list what was actually used or not used and provide reports.
All right. We are going to do
And
poll number
Paul,
2 here.
Can I add something
Sure.
to that specific topic? So at the beginning of the year when Etay and his team came through at a trade show, they we had just launched the one cart, and he and his team immediately loved not only the durability but the rigidity of it. So typically with uh, telehealth carts, they're not built to last. But furthermore, when you add a PTZOptics camera and you move the cart around, you get a lot of flag pulling or wobbling of the camera. But then when Etay uh, started to deeper dive into what they had built, it personally resonated with me or with my family, because it when my son was born, it took about 2.5 hours before my wife actually got to see our brand new baby boy. And the reason for that was because they potentially had left surgical instruments inside uh, uh, during the suturing up process. And so they had to unsuture and then reanalyze what was missing. And I can only imagine if I happen to be on this project, how many people in a small radius from where I live potentially have experienced something like that. And to know that this can be prevented, and the better efficiency and smarter approach to such a dramatic issue in healthcare, that's when this became a personal mission that I was going to do everything I could with our team to make this as perfect as it could possibly be. So that's why overall why we've moved so fast on this, because this is going in a direction that can't be stopped. And LayerJot's technology is go to market ready, and the form factor and the overall support that PTZ and their care team is involved at, it's a trifecta of perfect technology marrying really smart people that made LayerJot, including Etay.
Wow. It's such an amazing story, Brandon, and so real. Um, Thank you for sharing that. We have another poll that just went out. Oh, it just ended. Okay. Or I guess we'll share the poll results after. So LayerJot is just one example of the AI that we're seeing. Count Sheet AI is another one that's very popular. There's an SID app for scanning physical sheets for real-time instrument, and it can save hundreds of thousands of dollars, this type of technology, because of how valuable time is in the OR. If we can move to home health, Kevin, I'm going to let you cover this one, and I'm going to set up the iPad with Zoom, because Zoom is so popular as a HIPAA-compliant telehealth solution, so I can show that off while you're talking about it.
Excellent. Thank you, Paul. And in addition to the couple AI driven examples, the remote patient monitoring software that can detect egress, degress, and like patients falling from their beds. That's one of the other things that these 4K cameras using their computer vision can help with, making sure that care is top quality and nothing like that is missed. You have more eyes in more rooms, which is exactly what hospitals need, especially in an era of so many nursing shortages. So for home health, home health, healthcare, telehealth has become very popular in the last 5 years. And specifically, this allows doctors and nurse practitioners who might be in urgent care centers, who might be in private clinics, who can't reach a client in a rural area, maybe somewhere that's more underserved, that can actually reach those patients from the healthcare cart. So if a patient has their own webcam, they can stream right to the computer or the iPad that's attached to the one cart. And then the doctor has a camera to demonstrate certain things, whether that's physical therapy or occupational therapy techniques. They can be shown through that camera so that the patient can learn directly from the medical professional. That's just a couple examples of how home health can be revolutionized with something like this.
So this application here, I wanted to show the iPads, the brand new iPads, which are so popular in healthcare, now have a USB-C port. I think it's the USB Pros, the latest edition. And that's been a huge deal. Now, if we can, go ahead and zoom in on this. And what I'm going to do is I'm going to operate the PTZ camera to show what it's capable of here. And what I'm going to do is show you. Now you got to imagine that you have the ability to control that camera remotely, right? And so the view that is on the iPad for the nurse can now see exactly what's going on. And you have this really easy ability if you're a doctor. Now, we're here in a studio. Obviously, this would be maybe in a patient room. But if we wanted to choose a specific area to zoom into from a telehealth perspective, you can see that's coming up directly on the iPad, right? So I have full far end camera control in two different ways. I can control it directly through Zoom. I can control it through Hive. And I have all of these abilities now that we're using a robotic camera with no computer, right? Just an iPad. There's an iPad. The camera is connected to either directly to the iPad or to the network. So just wanted to show that off as an example there. Direct USB connectivity with any computer, but also iPads.
And Paul, can I note on something of value when it comes to the home healthcare side of things? Spending the first 15 years of my healthcare career in senior housing, 9 times out of 10, the adult children that might be displaced across the United States, and mom lives in a community, or she might live at home, right? But with that technology specifically that you were just showing, it gives peace of mind to the son that might live in Pennsylvania and mom lives in Spokane, Washington, and being able to communicate, but from the robust, and not to digress into a different conversation, but the robust scale in which LayerJot has built their software. I've been privy to similar software that has come from the LayerJot team, where it allowed analyzing of pills. So if mom's pills were set down on that table and the camera zoomed in on it, it would identify them, which would allow a son or daughter from afar to have peace of mind if mom still lives at home or dad lives at home. And so the robust capabilities that we are embarking on, that ultimately, if mom does or dad wants to stay at home and not uproot and move to a community, well, then they earn the right to do that. But how do we have a little extra TLC or a bigger blanket of protection for mom and dad and be able to interact with them? And all that can be done on an iPad with your technology and even potentially LayerJot's offerings, which is exciting. It's exciting for the retirement group that got us to where we are in this world. And that's a big push forward real fast.
Yeah, I agree completely. And it might even be even more true in educational simulations where we're educating the next generation of healthcare professionals who are learning from, the experts. And audiovisual comes into play here quite a lot, whether we're showing the camera feed on a large projector or if we are recording that video securely on either a hardware or a software solution that's HIPAA compliant. The educational part of healthcare is really important. And in this case, you're seeing a PTZ camera that's being remotely controlled, because oftentimes surgeons and experts that are doing demonstrations, their hands are tied, right? And so PTZ cameras allow you to get far away, but zoom in on those close-up details. So really important. It's a big part of what we do here. And I wanted to show just a simple example of a wiring diagram setup. Oftentimes in ORs and in educational environments, you want to be able to capture video views from multiple angles because someone can get in the way. There's different things. So this is showing 3 PTZ cameras connected with a joystick controller and a monitor to show it on the large screen. So we have all these diagrams, and Kevin can help you make diagrams and to kind of conceptualize what you're trying to build. But this is just one example. And here you can see, well, you can't actually see it that well because we have a text over it. Let me get rid of this text. But you can see there's actually multiple presentations going on at the same time. So there was actually 4 cameras total here. And they're using PTZ cameras. They're connected over the network. And for one use case is to view it on a large projector. And then another system is obviously doing the recording.
And clinical education by its very nature it requires shadowing or experience, I should say. So students really need the experience in order to learn. And so much of that is just following around a doctor to see what they do. And with a PTZOptics camera, you can actually have your own mobile film crew to capture what you do during the day so that you can reach that many more students, that many more people can learn from you, which it allows you to scale your education efforts. Using PTZ cameras, we can educate a larger group of doctors. We can help with that nursing shortage by having more medical professionals being educated at one time.
Yeah, we've had some really great examples of that with small spaces and operating rooms and classrooms, dentist school recently that we did where hundreds of students can join on Zoom where only a dozen or so could fit into the actual room itself. So just wanted to talk a little bit about some of the technology, and then I wanted to give Etay and Brandon a chance to do some closing remarks. But we talked about far-end camera control. We didn't dive too deeply into the high-quality image rendering that we offer, and it sets us apart from some of the standard webcams on the market. When you jump into a PTZOptics camera, and I'll do so here with the camera on the cart here, we give a high level of access to color correction and color rendering so that you can have an accurate rendering of the video. Sometimes an off-the-shelf camera will give a very saturated, very poppy color to it that works in a conference room, works in a lot of scenarios, but isn't necessarily color accurate. And so when you look at a PTZOptics camera, we can tune these cameras to the color of the room. So a lot of that has to do with the lighting in the room. And so we have the ability to do a white balance based on the actual lighting color temperature in the room. And you can see how much this changes the color just by going from automatic, which is what you'd probably see in a kind of off-the-shelf camera, to really tweaking it and saying, okay, are these fluorescent lights? Are these LED lights? Because when it really gets to be important in healthcare scenarios, the color of a skin color, for example, and skin tones and telling if something is a rash or not, it's really important to have that color rendering correct. And we do that. We give the ability, every single camera has these in-depth color correction profiles. All right. So that leads us to kind of our last thing, which is we wanted to show the new privacy feature, which can be enabled with a click of a button, allowing you to quickly turn the camera around when it's not in use or when there are private situations in the space. We did look at far-end camera control, so I won't jump into that a lot. But one of the big things that's built into PTZOptics cameras is called UVC control. That's a universal video codec. A lot of our healthcare clients use that because it will automatically work with Zoom, VC, and a lot of the other platforms that are out there that are HIPAA compliant. They use UVC, so plug and play connectivity for far-end camera control and the HIPAA compliance. So I'll leave it at that because I don't want to go too far into the weeds. We do have a dual sensor camera with some really cool features as well for setting up special tracking and preset zones. But we don't have enough time in this webinar to fully go into that. So I'll just leave you guys with our last poll question here, and then I'll let Etay and Brandon do some closing remarks. But the question is, which technologies will your organization invest in over the next 12 months? Is it virtual nursing and remote patient management, surgical video capture for training and optimization, or AI-enhanced workflows?
Yeah, and this is just our first of our healthcare webinars at PTZOptics, and we're going to be doing one every quarter, so we'll be able to cover some of these other things we didn't get to today.
Awesome. And Brandon and Etay, are there any closing remarks that you have you'd like to go? And then, of course, we will be happy to answer questions as well.
Yeah, so I just want to say that we've been testing a lot of cameras along the years for computer vision. It's really important to get the right pixels in the right color to be able to do things. And PTZ camera has both the ability to zoom from a distance, but also the autofocus is amazing, and it has a very detailed API. So if you're thinking about building a solution for healthcare or any other area that you would like to utilize a camera that is flexible and can work with what you're trying to build, then PTZ is a very good choice to look into. Thank you.
Thank you, Etay.
And similarly to Etay's talk track, in regards to the overall application and what LayerJot has built, and with the overall support that and Paul, you and I have been friends for years, and it took a lot of vetting to get us together because, to Etay's point, there's a lot of high bars that need to be met with quality when it comes to optics, and this partnership amongst StrongArm Healthcare, PTZOptics, and LayerJot is a rare marriage, because we are the best of these three important applications, and I'm very excited for what's to come. It's gonna make waves, to say the least.
A magnificent union of technologies.
Well said.
Well said. Well, I want to thank everyone for attending. We're going to do these quarterly because there's so many new things coming out. Etay is going to be doing a full launch in October. We have some new healthcare features and products coming soon. So stay tuned. Thank you so much for joining, everybody. Thank you for taking our polls and quizzes. We're going to probably try to share those results out with everyone. And Zoom Events is a great platform because it allows for polls. It allows for the sharing of that information with everyone. So we really appreciate it.
Yes, thank you all for joining us, and for your healthcare needs and AV, you know how to reach out to.
Thank you, guys.
Everybody. Thanks, Brandon.
Thank you.
Thank you, Etay.
All the best.
Yeah. See you guys.
Bye.
Thanks.
Okay. Good job, Brandon.
Still recording.